No anesthesia, no sterile tools, absolutely zero understanding of infection or bacteria. I mean, imagine facing severe trauma or even going blind in a harsh prehistoric landscape thousands of years before the dawn of modern medicine. You'd probably think undergoing a surgical procedure under those conditions would be an absolute guaranteed death sentence, right? But the physical evidence left behind in actual human bones tells a completely different, almost impossible-sounding story. Welcome to This Explainer. Today, we're not just busting myths. We're diving deep into the hard, physical evidence behind some of the most mind-blowing ancient surgeries in human history. We're going to look at what the archaeological record actually proves about their success rates, because these weren't just brutal, random acts of desperation. As you're about to see, ancient surgeons performed incredibly complex procedures on patients who didn't just survive the trauma of being operated on, but lived for years and years afterward. So let's get right into it. Now, this immediately begs the question, how on earth did ancient patients actually survive this? When we strip away all of our modern safety nets, the heart monitors, the completely sanitized operating rooms, our deep cellular understanding of the human body, how could anyone successfully navigate the complex anatomy of the brain or the eye? Well, to unravel this mystery, we have to look at a procedure that has literally baffled archaeologists and medical historians for decades. Let's start with trepanning. This is the practice of cutting, scraping, or drilling a literal hole into the human skull. It sounds visceral, it's definitely terrifying, and frankly, it feels like it should be totally impossible to survive. And yet, it's one of the oldest known surgical procedures in human history. We've actually found evidence of trepanning across multiple ancient cultures on nearly every single continent, dating all the way back thousands of years. But honestly, the mere existence of these skulls isn't even the most awe-inspiring part. What's really interesting about this is that the undeniable proof of human resilience is literally written into the bone. Archaeologists don't just have to guess if these surgeries worked. They can literally read the outcomes. See, if a skull was trepanned and the patient died right after, the bone edges around that hole remain sharp and unremodeled. That basically equals death. But across a surprisingly huge number of recovered skulls, we see something truly miraculous. We see smooth, rounded bone growth around the opening. This is direct, undeniable physical proof of healing. And bone only heals and reshapes like that if the patient lived for a substantial amount of time after the surgery. In many cases, we're talking years. So why in the world would ancient people deliberately open the skull of a living person? Well, the motivations actually varied quite a bit by culture and era. A massive part of it was early trauma care, like treating serious head injuries, managing severe skull fractures, or relieving incredibly dangerous swelling and pressure on the brain. Now, in other contexts, it might have been deeply tied to spiritual or ritual beliefs, maybe aiming to release spirits or sickness from the body. But regardless of the underlying reason why, the physical technique itself tells a pretty incredible story. Because to achieve those smooth, beautifully healed bone edges, these ancient practitioners had to have highly refined, transmitted knowledge. They had to know exactly how much bone to remove without piercing the incredibly fragile brain just underneath. They had to understand how to control severe bleeding from the scalp, and they absolutely had to know enough about post-operative wound care to give their patients a real fighting chance. The consistent success rates we find at these ancient sites basically prove that this wasn't guesswork. It was a carefully taught, mastered technique. Okay, let's pivot for a second and see how this resilience carries over into an entirely different realm of ancient medicine. We're moving from the hard, durable bone of the skull to one of the most delicately complex, sensitive structures in the whole human body, the eye. The stakes here were incredibly high, and the anatomy was totally unforgiving. To really wrap our heads around this procedure, we first need to understand the threat. A cataract is a clouding of the eye's natural lens. Today, fixing it is a super routine, everyday outpatient procedure. But back in the ancient world, developing a dense cataract meant total, permanent blindness. Losing your vision in an era way before any modern social safety nets was a completely terrifying prospect that genuinely threatened your survival. And that sheer desperation for a cure led to a truly audacious medical innovation. Enter a procedure known as cataract couching. Just imagine performing this with Iron Age tools. First, a sharp instrument is inserted directly into the eyeball. Next, that same instrument is used to physically push or displace the clouded, opaque lens right out of the direct line of sight. Finally, the lens is just left displaced within the eye itself rather than trying to fully extract it. This technique actually shows up in ancient Indian medical texts and spread all across the ancient Mediterranean and Islamic medical traditions. It is quite literally precise biological engineering performed thousands of years ago. Now, here's why they were willing to take such a massive, honestly terrifying risk. Without couching, the patient faced inescapable blindness, period. But after couching, well, the results certainly weren't perfect. Because the eye's natural focusing lens was knocked entirely out of place, the resulting vision was typically pretty blurry. And obviously complications like infection or spiked eye pressure were always looming threats. But for someone trapped in total darkness, gaining back even meaningful functional vision, just the ability to see shapes, navigate the world, and regain some independence, was a massive, totally life-changing medical victory. Which brings us to what is probably the most fascinating mystery of this entire explainer. How did they know this would actually work? They had zero diagnostic technology, they had no understanding of cellular anatomy, bacteria, or modern physiology. So, how does an ancient civilization develop these exact, high-stakes techniques without any of the underlying science that we consider absolutely strictly necessary for surgery today? The answer lies in the empirical method. This wasn't just a case of some ancient doctor waking up one day and guessing how to poke an eye with a needle. Not at all. This was deep knowledge, refined through rigorous repetition, direct transmission, and generations upon generations of apprenticeship. These early practitioners were basically operating as the world's first empirical scientists. They carefully tracked their trial and error, paying close attention to what actions led to survival and what actions led to failure. They essentially built an entire system of medicine based purely on observation, even if they couldn't explain the underlying biology behind it. And this generational knowledge allowed them to develop what we call transmitted judgment. By accumulating countless cases, teachers could pass down absolutely critical insights to their apprentices. They learned how to identify which patients were actually good candidates for surgery in the first place. They learned how to spot those deadly warning signs that meant a procedure should be abandoned immediately. And they figured out which postoperative care routines gave their patients the absolute best chance at recovery. It was a literal chain of knowledge passed from human to human across centuries. Now, to be completely intellectually honest here, we have to acknowledge the darker side of this reality. Ancient surgery was brutal. For every miraculous survival story permanently etched into a healed skull, there were absolutely failures. We've found Trepanning skulls that show absolutely no signs of healing, which sadly means the patient died on the table or shortly after. Couching carried real, incredibly severe risks. These ancient doctors operated with failure rates and complication levels that would be completely unacceptable in any modern hospital today. The risks were just incredibly high. But that brings us to the core takeaway of this whole explainer. Terrifying and ineffective aren't the same thing. Look, it's so easy to look back at our ancestors and view their medical practices as pure barbarism or just blind desperation. But they weren't operating blindly. Achieving any meaningful survival rate with basic Iron Age tools is a profound testament to their accumulated skill. They pushed the absolute boundaries of human survival through sheer observation, raw courage, and passed down wisdom. So the next time you think of ancient medicine, remember the incredible physical resilience of the human body and the deep empirical ingenuity of the human mind. Which leaves us with another fascinating mystery to uncover. If ancient surgeons could successfully operate on skulls and eyes without modern technology, could ancient doctors accurately diagnose complex internal diseases using nothing but a patient's pulse, the look of their tongue, and careful observation? Keep that question in mind. Thank you for exploring this incredible history with me today, and I'll catch you in the next explainer.